Hello there. My name is Councillor Rebecca Charlwood. I'm the chair of the Health and Wellbeing Board for Leeds. I'm a Labour councillor. I represent Moortown Ward in the north of Leeds. And in the council, I'm a cabinet member and I cover adult social care and public health.
Hi, my name's Hannah Davies and I'm Chief Exec at Health Watch Leeds. For those that don't know Health Watch, we're an independent organisation. There's a Health Watch in every local authority area, but our role is to listen to the experiences of people in their health and care journeys and feed those experiences and themes into decision making within health and care structures in Leeds. And I'm also a member of the Leeds Health and Wellbeing Board. So for this presentation, we're going to be talking to you today about our Health and Wellbeing Board in Leeds and our Health and Wellbeing strategy. We'd like to talk to you about the important role that the community sector and people's voices play in helping achieve our strategy, reducing health inequalities in the city and delivering our person-centred approach in Leeds. And finally, we will talk you through a case study which shows why working with the community sector and with local people matters and how those established relationships have helped shape our city's response to the COVID-19 crisis. Councillor Charlwood will start by talking to you about the board.
Thank you. So on this slide, we're going to look at what is the Health and Wellbeing Board. Well, it's a group of senior representatives from organisations in the health and care system across Leeds. So that's Leeds City Council, and from there we'll have the Director of Public Health and the Director of Social Services, Children's Director. We also have the Chief Executives and Chairs from the NHS bodies, representatives from the third sector and Health Watch, and also Safer Leeds to help us with sort of looking at sort of a criminal justice aspect as well. The board was officially established in 2013 as a result of the Health and Social Care Act 2012. But in Leeds, health and care and wellbeing organisations have had a really long history of partnership working, which predates that national legislation. We established the Healthy Leeds Partnership Group way back in 2003, recognising the importance of working together and planning together for our population. And that eventually evolved into the board as it is today. But even before that, the council, local NHS organisations and community sector groups have proudly worked in partnership. It's our Leeds way, and we're very proud to do that together. So as a board, it's our role to understand the health and wellbeing needs of our local population. And in Leeds, we have 800,000 people thereabouts. And we have to develop unified approaches to addressing those needs together as a system. We then can commission services to meet those needs together. To understand the needs of our local population, we use what's called a Joint Strategic Needs Assessment process, the JSNA, and it provides a detailed and live analysis of key demographic, socioeconomic and health trends in Leeds. So in Leeds, we've adopted a really robust process of JSNA, and it extends its remit beyond just health and care. We recognise that health is determined in large part by the communities in which we live, as well as by our economic circumstances. This includes our environment, the nature of our relationships, whether we have a decent education or a job, and the quality of our housing, for example. So we use the findings of our needs assessment to inform our health and wellbeing strategy and plan our services through commissioning from the council, for example, through public health commissioning and social care services, and the CCG, the clinical commissioning group, also in the NHS commissions significant numbers of services. So the Leeds Health and Wellbeing Strategy 2016 to 2021 remains the primary document that describes how we improve health and wellbeing outcomes for the people of our city. This strategy was launched in 2016 and it was developed following engagement with local people, with community organisations and with other key stakeholders, and the board itself pulls it together. And findings of the JSNA really contribute to it as well. So this slide shows you a summary version of our strategy. Our ambition for Leeds is that we want to be the best city for health and wellbeing. It's an aspirational vision and it's a common purpose that we can all get behind, from GPs to our third sector to our in-patient services, and one that all partners can play a part in achieving. But to be the best city, we have to reduce health inequalities. And our vision is that Leeds will be a healthy and caring city for all ages, where people who are the poorest will improve their health the fastest. We know through our joint strategic needs assessment that there are deep inequalities in our city. For example, a child born today in one of our more deprived inner city communities has a life expectancy that is more than 10 years below that of a baby born in one of our wealthier, perhaps outer city communities. And there are really many reasons for this. Some of it is to do directly with our health. For example, you are more likely to be overweight or obese if, as a child, you live in some of our poorer communities. Smoking and alcohol rates are also higher in the communities I've mentioned, and levels of physical activity also differ. So we need to commission differently in those areas for different needs. Other reasons are related less directly to a person's health, but have an impact on their health. And this is what we call the wider determinants of health. So, for example, you live in a poorer community, you're more likely to live in a house that is in a poorer condition and that has more people living in them. You're more likely to have a less high quality job and perhaps work 0-hour contracts, or even work 2 or 3 lower paid jobs. And perhaps crime rates may be higher. Populations may be more transient as well, which can negatively affect a community's sense of spirit and belonging. And we know that the greatest predictor, actually, of someone's health in the long term, in their future, is the educational attainment they have at the age of 18. So all of these factors contribute to somebody's health, to their quality of life, and ultimately to life expectancy, and on the relative dependence on the health and care services that we offer as a city. So while we know that there are some big challenges that the city needs to address to improve health and wellbeing outcomes, we are also really proud that we have made progress since implementing our strategy. Last year, we became one of only a handful of cities in the world to record a reduction in childhood obesity and a higher reduction in areas of high deprivation. So priority 1 of our strategy is to ensure our children have the best start in life. Obesity in childhood is linked to longer term health implications, lower quality of life. And I'm, for example, the Baby Friendly UNICEF initiative champion, which works in health settings to support breastfeeding. We have gold accreditation on that in Leeds, which is really, really great and has helped a lot in our anti-obesity work. We commissioned Henry to work with families to support healthy eating in the really young. We also know that there's more to be done to tackle childhood obesity and improving health outcomes for children and young people, but we've made a start through targeted action such as this. Priority 10 of the strategy outlines our commitment to tackling mental health issues in the city, huge priority for us. And last year, for example, we became the site for the first clinic of the Northern Gambling Service. Now, this is an example of a service offer for people providing specialist addiction therapy and recovery to people affected by gambling addiction, as well as those with mental health problems such as depression, anxiety, trauma, and suicidal feelings. And we know that a crisis of this kind can become a health crisis as well, as people move further towards the edges of their society and their community. Supporting people to remain well and have greater well-being ultimately helps the system and to cope with the amount of demand that we have, and it's the right thing to do for those individuals. There are many more examples where the health and wellbeing strategy is making a difference to the lives of people, and I can't go through them all today, but we produce an annual report in which we outline our progress against all 12 priorities in the strategy. And if you're interested in finding out more, the annual reports are all available on the website. The current pandemic will create new priorities for us and will mean further focus on tackling deeper divisions that may have been created in more vulnerable parts of our communities. So I'm going to hand over to Hannah in a minute, who will talk about the important role that the community sector in Leeds plays in helping us to achieve our priorities, as well as the role of local people. But I want to leave you with this next slide. So our wider partnership. I'm not going to go into detail on this slide, but it really provides a useful visual to show that the Health and Wellbeing Board is really the tip of the iceberg when it comes to partnership working in Leeds. And whilst these partnership groups all operate at different levels, for example, some are citywide, while others are focused on particular communities, others are focused on whole population issues, they're all committed to achieving our common ambition of making Leeds the best city for health and wellbeing and to improve the health of the poorest the fastest. Hannah.
Thanks, Councillor Charlwood. I'm going to talk to you now a little bit about the community sector, the third sector we have in Leeds. unlike lots of other areas, Leeds has a really thriving community sector. We've got over 1,600 charities based in Leeds, from small community groups through to large multi-million-pound third sector organisations, who support some of our most vulnerable residents in communities that are experiencing the highest level of health inequalities. This includes, for example, supporting people in poverty, migrants, refugees and asylum seekers, the homeless, people with disabilities and people from Black and minority ethnic communities. In priority 3 of our health and wellbeing strategy, we are committed to empowering our community sector and really recognising and harnessing their strengths for the benefit of the people they support. The community sector, third sector, is represented at the highest levels of decision making here in the city. And part of the reason for that is the ongoing commitment and leadership shown by the council and others that have recognised the role of the third sector and funded good established third sector infrastructure in Leeds to enable this to happen. So we have third sector leads, which are the main point of engagement with the third sector in Leeds, working together to coordinate representation of the third sector on key statutory partnerships and boards, many of which Councillor Charlwood identified in the earlier slide, engage with and influence the decision-making processes of all its key stakeholders, including Leeds City Council and the Clinical Commissioning Group. They produce positioning papers on topics of interest to the sector, and they develop third sector policies regarding key strategic issues, such as commissioning and community asset transfer. In addition, though, within Leeds, we have an organisation called Forum Central, and they're a specific health and care third sector infrastructure organisation, which has a membership of over 300 organisations working in health and care every day here in Leeds. By working together through Forum Central, the health and care third sector community is able to maximise their impact on decision making, and their members are able to use their voices to influence strategic developments across health and care. So involved in planning on a daily basis in things like mental health, learning disabilities, older people, younger people, and more. As we've said already, in Leeds, our statutory organisations are committed to working in partnership with the community sector at the highest level and utilising their expertise to inform decision making. That is to be celebrated and is something we're really proud of in Leeds, but that alone is not enough. We're committed to empowering our community sector to thrive within the communities they serve, so they can provide services built around the needs of people, especially those people who are living with the greatest health inequalities. We recognise that by doing this and by tackling health issues in community settings, that will have a knock-on impact on the demands of our more traditional health and care services, such as hospital access. In Leeds, we call this our left shift. I'll hand back over to Councillor Charlwood.
Thank you, Hannah. So, we wanted to talk to you today as well about the left shift in Leeds. It's a sort of conceptual idea that everybody seems to get behind and understand. So the Leeds left shift, in its simplest terms, means that as a health and care system, we're committed to putting a bigger focus on prevention, self-care and early intervention in any emerging services or any commissioning. So we know that if we can get more resources upstream to support prevention and early management and treatment in the community or in somebody's home, targeting communities that need to access services the most, then we maybe can have a huge impact on the quality of life of people and ultimately help reduce the risk of them needing to attend acute settings. And we're always interested in trying to reduce demand on our NHS services and our social care services for many different reasons. This works particularly well with our ageing population. For example, our falls prevention work and our loneliness services, which we commission through the third sector, are two examples of how something very practical can keep people well who might otherwise end up in hospital more frequently. Another example of this principle is with smoking. So as a result of our smoking cessation services, we've seen a year-on-year reduction in smoking rates, which is great for local people, but also in the long run will help reduce demand in our hospitals to treat patients with smoking-related illnesses. But it's obviously not as simple as moving one pot of money from treatment settings to fund prevention. Money is a finite issue for our whole system. So, you know, it's great that we're reducing rates now, but in years to come, that will benefit the hospital. But right now, the hospital needs the money to treat the people who are coming through the door now. So we have a double funding conundrum. So this is where we know that if we fund the voluntary sector, we can get a huge amount of benefit for the funding that we put in. Clinical services are very expensive, and our voluntary sector is outstanding, but it is significantly less expensive relatively to fund. And if we can shift a bit more of the funding that our statutory organisations like the Council and the CCG have access to into our community sector to work on wellbeing and positive health, then we can stem some demand for future years. It's incredibly challenging as budgets are tighter each year and it continue to reduce, unfortunately, year on year so far for the last few years. And obviously our demands are increasing as we have an ageing population. But we've been able to get our health and care partners in Leeds to agree to this approach together and to push more funding into our community services to help achieve our left shift, which is a great vision from our system leaders and something I'm very proud of. And just to say, a left shift is a left on the page. So if you think of prevention and community at the left-hand side of the page, and a flow chart that took you to the right-hand side of the page would be a hospital setting, then we're trying to get more funding down through to the left of that page, and that's why it's called the left shift. So together we're really committed to empowering our voluntary sector, and through funding streams such as the Better Communities Fund and the Harnessing Power of Communities Fund, we've been able to see that a bit of funding in the community sector can go a long way and make a big difference. We find new ways all the time to make it easier for our community groups to access funding. Small incremental changes that enable us to deliver on our essential services while looking to the future with the support of the community sector. The left shift is going to be really fundamental to delivering our health and wellbeing strategy and our ambition of making Leeds the best city for health and wellbeing in challenging circumstances that we're in. So we have to stay committed to it, to that vision that we have together in the city. And it's also a really important principle of our local care partnerships, which I think Hannah will talk to you about now. Thank you.
Thanks, Councillor Charlwood. So we've already talked about the Health and Wellbeing Board and our strategy, which both have a city-wide remit. But we know that if we're going to achieve our left shift, which is about improving people's outcomes, we need to focus on local communities. Leeds is one of the biggest cities in the country with a diverse population that we are extremely proud of. But with size and diversity comes a complexity in the health and wellbeing needs of the population. That is why in Leeds we've established 19 local care partnerships in Leeds, each covering a specific geographic area of the city. Through our local care partnerships, we recognise that the needs of individual areas are different. The makeup of the population, the quality of housing, the employment opportunities, the determinants that affect a community's wellbeing differ across our city. Local care partnerships bring together key partners in a local area, such as GPs, nurses, elected members, community sector and other NHS providers. These people are closely connected with their communities. They are based in their communities. They have a developed understanding of the needs of the people they serve, and therefore they are well placed to ensure services are built around those needs, meaning people will be able to access the services they need closer to home too. Ultimately, this means we can improve the health of local people, achieve our left shift and reduce inequalities. One of the benefits of the local care partnership model is that each local care partnership is able to draw on the insight that each of those partners brings. They have daily contact with people, they understand local people, but we also need to have stronger people involvement within each of these local care partnerships. Whilst data gives us a part of the story in the JSNA and the Joint Strategic Needs Assessment, it's important we also have the insight from people and we listen to the voices of people. This is where the work of the People's Voices Group plays an essential role. The People's Voices Group in Leeds is a partnership group of involvement leads from across the health and care sector within Leeds. We chair it here at Health Watch Leeds, but it's a formal group linked to the Health and Wellbeing Board. The members of the group champion the principles of good engagement practice, and increasingly we work together as one health and care involvement team. Over the past couple of years, we've really developed our work, seeking to develop an ambition, which is all about putting people's voices at the centre of our health and care decision making. We believe that you cannot make effective decisions without having local people involved with those decisions. without having people with lived experience working with you to design services. This is what you're seeing on the screen here is a model that we've developed that we're using across our health and care work. And essentially it says that everything has people at the centre. So we need to start with people outcomes. All our services should be designed with people. We need to communicate in a different way with people. We need to work with people in a different way. And importantly, we need to evaluate our services with people. We shouldn't be evaluating by levels of activity. We should be evaluating on the difference that it makes to people's outcomes. We've also developed a number of innovative new ways of how we want to listen to people within Leeds as a collective health and care system. And a couple of years ago, we started a new initiative called the Big Leeds Chat. And since then, that's really embodied how we want to bring together real local people with the decision making that we make here within Leeds. I'll just kind of go on to the next slide, please, Aid. And we just wanted to leave you with a quote from the Care Quality Commission. They came to Leeds in 2018 to review our health and care system. And one of the key findings of their review was around the strength of the voluntary sector in our system in helping develop services. And they said, there is good engagement with Healthwatch and the voluntary community sector in developing the health and wellbeing strategy. They are seen as system partners, and work with the voluntary sector is a strength in the system in terms of the development of services. I'll hand over to Councillor Charlwood.
Thank you very much, Hannah. Great. So just to go on to a bit about responding to the COVID pandemic recently, which I think is important as an example of how we work together, a very practical and real one. So we've also tried to give you a really brief high-level overview of what is a very complex partnership in Leeds, and explain the role of our board and the strategy and how things flow from that. And we want to really finish with an example of how our strong partnership between our statutory bodies, community sector and local people has made a difference on the ground. We're really, just as an aside, we're really committed to asset-based community development, which is ABCD, but it's how to build up assets in our communities. And those assets could be people, could be buildings, could be opportunities to help people live the lives they want to live. So as with all other cities, Leeds has obviously had to deal with the coronavirus pandemic, and we continue to do so in many different ways. And it's a challenge. And it's been deeply difficult in many respects. But right from the start, we knew that the community sector had to be at the heart of what we did in our COVID response. One of our first actions at Leeds City Council was to establish a Communities of Interest network, which was a network of 22 community organisations in the city. Each organisation worked with a particularly vulnerable group. For example, people with learning disabilities, people who are gypsies and travellers, refugees and asylum seekers. And through the network, we were really able to make sure that no communities got left behind at a very, very fast-paced time, very challenging time. Network partners were able to engage with their communities, understand the impact that the lockdown and the pandemic was specifically having on them, and ensure that they had access to the essentials such as food and medicines, and also making sure that they were getting reliable information about staying safe from the virus. And for some of the most vulnerable people in our city, this network of community groups, working in partnership with the council and the NHS organisations, has undoubtedly helped protect lives. We also worked with the community sector to establish a network of 33 community hubs, which were geographical places with a specific purpose to, had a similar purpose to the community COIs, but were based within a geographical area. And this network helped 7,000 volunteers from the public to be quickly established and mobilised to help people in our communities. We worked with an organisation in Leeds called Voluntary Action Leeds, who have a great deal of experience of recruiting and utilising volunteers. And people really came forward to offer their help to people who were shielding, isolating and unable to leave the house. So by working in partnership with them and the hubs that we put together, then we were able to quickly recruit these volunteers and help out with the effort in keeping people well. Working through the community hubs, they were able to get food supplies out to local people, go out and do shopping for people who were isolating, and we made a financial arrangement that made that safe for everybody for them. And the council became the sort of facilitator of what was a very community-based response and allowed that to happen safely for our vulnerable people. and even to keep our volunteers safe as well in what was a very challenging time. People also did calls and phone calls to catch up with people, make sure people were okay in their homes. I've really only scratched the surface of that and what we've done, but it really gives a good example of how quickly the council and our NHS organisations and community groups were able to work together to safeguard the lives of people. So thinking about the left shift, by investing a little bit of money in the community sector, we help to protect the health of some of the most vulnerable people in the city at scale and at pace. And it helped reduce demand on our health services and help protect our voluntary sector by providing them with some funding at a much needed and difficult time. So we're able to get the structures in place quickly, thanks in part to our strong relationships that we had developed over many years. And the voluntary sector continued to inform and influence our decision making throughout the pandemic, with representation on all of our key emergency response groups, contributing their insights from working with and engaging with communities in discussions so that we could continue to meet the needs of local people and that we were doing the right thing at the right time. We've also continued to hear directly from local people throughout the pandemic, thanks to Health Watch Leeds. So I'll hand back to Hannah. Thank you.
Thanks, Councillor Charlwood. As we said, it was really important during the pandemic that we continue to hear the voice of people, especially as things are moving and evolving so quickly, and the amount of distress and significance it was having on people's lives. So at the start of the pandemic, as people went into lockdown, we felt it was more important than ever to hear the people of Leeds. Therefore, we launched a programme, a listening programme called the Weekly Check-In. We asked people a series of questions each week to tell us about their experiences, about their needs and what support they needed to be able to stay healthy and safe during the pandemic. We targeted different community groups each week, particularly some of the most vulnerable communities who would be most adversely affected by the pandemic. For example, people who were shielding. We also checked in with community groups so that we could gather intelligence on how they and the people they serve were coping with the pandemic and the lockdown measures. And we pulled this insight together into a weekly report and shared it with key emergency response groups and with the senior decision makers so that they could continue to evolve the support that was being made available. This played an important part in being able to reduce the impact of the lockdown for people, particularly for people at highest risk, as Councillor Charlwood just mentioned. We're going to draw our presentation to close there. Thank you for listening, and we hope you found it useful.